Hello. This is the second part of the unit titled Articulation and Resonance. And in this part, we're going to speak about the part of the vocal tract, which is the oral cavity. The oral cavity, basically the mouth. We know that the boundaries anterior to posterior boundaries are the lips anteriorly and the facial pillars. Then we have the sides, inside of the oral cavity, we have the two cheeks. Or we know them as, inside of the cheeks, between the teeth and the cheeks, we call that the buccal cavities. And then superiorly, we have the hard palate and the soft palate. Inferiorly, we have the muscles that make the floor of the mouth, which, basically a set of muscles that we studied before, including the geniohyoid muscle, geniohyoid. And of course, we have the genioglossus. So basically, the tongue sits on these muscles, and we are going to speak about the tongue in the next section. So let's look at the roof of the mouth, beginning from the two broad front teeth here, and then we go back and trace it backwards. And the first part is the hard palate, which is the part of the roof of the mouth that actually has bone in it. So you could see here, these are the maxillary incisors, 1, 2, 3, and 4. The 4 front teeth in the front. And we call them maxillary incisors because they insert onto the maxilla, the front part of the maxillary bone. And this part where all the teeth insert, all this horseshoe structure, which we call the upper jaw, that is called the alveolar process. The alveolar process. Part of the alveolar process that is particularly important for us as a speech-language pathologist is the alveolar ridge, which is behind or posterior to the two central maxillary incisors. So these two front teeth that are broad, and behind them go higher a little bit, and you find a little ridge that we know as the alveolar ridge. When you say t or s or d or your tongue tip will touch it, and then we call this sound, or any sound that involves contact between the tongue and the alveolar ridge, we call it alveolar. So you could see different structures here on the hard palate. The front piece that is behind the central incisors, and it makes like a kind of a triangle, like on each side. That area is called the premaxilla. So here. And it grows by itself. So there's a suture here, and the suture here, and in the middle, there's a suture. So that means this piece of the premaxilla grows individually. It buds out of the shelf of the maxillary process, and it grows medially inward, towards the middle. And the other side grows towards the middle, and they fuse here in the center. Fusion begins from front to back. And then once you start this fusion, then you have the fusion of the second part of the hard palate with this. So then you have this little area. I'm going to show it to you on the next slide. It's clearer. Here, that is called the palatine process of the maxilla. On the other side, there's another process. and these two grow like little shelves of the maxillary maxillary process here on either side, and then they grow and grow towards the middle, and they meet, and then they start to fuse and fuse and fuse from front to back. Then behind, so this place behind behind the palatine process or palatine processes of the maxilla, then we have the palatine bone. Part of the palatine bone here, this part is called the horizontal plate of the palatine bone. The palatine bone is bigger than this, of course, but it just comes down at some point, and it goes down and it makes this kind of structure where it fuses with the palatine processes of the hard palate. And so now the posterior segment of the hard palate is made up of the palatine bone, and the palatine bone again has two segments, left and right, and each segment grows out individually, and then they fuse at the midline from front to back. And these two areas of the palatine bone are known as the horizontal plates. So here's one horizontal plate, and here's another horizontal plate. Then, so these are the three structures of the hard palate. Again, premaxilla, palatine processes of the maxilla, and the horizontal plates of the palatine bone. And then on this margin, on the posterior margin of the palatine bone, we are going to have a structure. So this is the palatine bone. On the posterior margin here, we are going to have a structure that is known as the palatal aponeurosis. The palatal aponeurosis. It is basically some kind of tendon that fuses onto or inserts onto the margins, the posterior margins of the palatal, horizontal plates of the palatine bone. And to that palatal aponeurosis, you are going to have the soft palate or velum muscles attaching, inserting on it. Here is again there's the structure here, as we explained, basically the premaxilla and the horizontal plates. The palatine processes of the maxilla, and then you have the horizontal plates of the palatine bone, and then we're going to speak about the other structures later. The area between the two sides of the premaxilla, there's a tiny area, like a little hole. It's called the incisive foramen, and that is for blood vessels and so on, but it's not open. It is just a hole in the bone, and it is sealed with tissue, closed with tissue normally. And you could see the part of the palatine bone here in the back and how it is fused with the palatine processes here of the maxilla. And in here on these margins here, you are going to have the palatal aponeurosis that we are going to discuss later. I also would like you to pay attention to the structure that we know as the pterygoid plate here. So the fusion begins anteriorly, and it goes progresses posteriorly. So just like a zipper that you close from the front, and as you keep going back, you keep closing and closing in the back. And if the hard palate is not closed, then the soft palate has no way of closing. And the condition, the medical condition that results from lack of closure of the two sides of the hard palate and the soft palate, we know it as cleft palate. So cleft palate, cleft comes from cleave, to split, and cleaver is like that big knife that a butcher would use to split. And from that word also the word cleavage comes. So cleft palate, there are many forms of it. There are, for example, situations where the two parts here in the front, lateral, left and right, do not fuse. And if the two parts do not fuse, we call this unilateral cleft lip, and then you have the cleft palate as well. So bilateral, two sides, bilateral. And if it is one side only, then it is unilateral. And when these fail to close, they are not closing one side, for example, you cannot get the tissue of the upper lip to close with the other side, because the tissue here, we go this way, every part of the face grows on a different side, and they just as they grow, they unite and fuse at the midline, and then you have a whole face that is completed. But you could see the lines of fusion between the two sides of the lower lip, for example. There's a center here where you could trace it, you could see it, and it is more visible in some people than others. You could see also here in the top one, the line of fusion where the right and left fuse. So again, if you do not fuse the arch of the maxillary bone beneath where the teeth are, there is no way that tissue of the upper lip can close. So we have cleft lip and palate. We might have unilateral cleft lip or bilateral cleft lip, and then you have hard palate cleft all the way, and that continues through the soft palate because the fusion begins from the front and goes backwards. So the condition of cleft palate, of course, it involves so much information, and this is not the situation where we're going to cover it, but just to give you an idea, if you want to learn, I mean, I would encourage you to learn more about it by just Googling or going to YouTube and watch videos by Operation Smile. So there's an example here of a unilateral cleft lip and, of course, a cleft palate. And you could see what you are looking at here is the roof, not of the mouth, of the nasal cavity. So if you take out this little, behind this tissue here, there's the base of the skull, and right above that is the brain. You are going to see that there are countries in the world like India and some countries in Africa where the palate is not, they just, people live to reach adulthood without a repaired palate. And it just, there are so many cultural things associated with it. You can learn more if you go to Operation Smile, and they will show you cases of people, who, and how they suffer as a result psychologically and in every, possible way. You need to understand, you need to know the dental structures and to be able to identify them on a chart. You need to know every tooth by name and the age of eruption and the number of teeth that a child has versus the number of teeth that an adult has. So we have the deciduous teeth or arch and the permanent teeth. So sometimes these are called milk teeth. These are not permanent and they erupt between ages 8 months and 2 years. In your textbook, you are going to find exactly exact dates for the eruption of each one and for the disappearance of each one of these, because they tell us a lot about the age, and also they tell us a lot about the speech production. So we need to pay attention to this. So they start to basically shed between ages 6 years and 12 months. You will find some variation, but these are averages. And then the child by that time, 12 years or so, they are going to have 10 teeth on each arch. The permanent teeth, no, I'm just speaking about on the side, the deciduous. So the permanent teeth, they erupt to replace the old ones, but some new ones also emerge, like the wisdom teeth, for example. They were not there before. So 6 years to 17 years and plus, which is 17 and above, that is the wisdom teeth. And when do teeth or these teeth shed? Can you figure that out? Well, I hope you don't ask me, when they shed, because you should be able to figure this one out. So the complete set of the permanent arch is, again, from back to front. You have 3 molars on each side. So each, below, you're going to have, below, on the right side, you have 3. On the left side, you have 3. So that is 3 here times 2. That is 3 times 2. That means 6 molars on one arch. And then premolars, you have 2 and 2. 2 in left and 2 right. And then you have the canines, 1 and 1. And the incisors. So that gives you 16 teeth on one side times 2. That is 32 teeth that someone has. And the permanent arch. So here is the child's. Here is the deciduous arch. And let's count them. You have 4 front teeth, which we call the incisors. So you have 2 in the center called central incisors. These are the big front teeth, the top ones, and the lower ones in the center. They're called central incisors. An incisor is basically, to incise is to cut. So to make an incision, to cut. So the front incisors, the incisors are teeth that we use to cut things with. You use them to cut into food, bread, or apples, or whatever it is. So this is why, and they're sharp. So 2 central incisors, 2 lateral incisors, and then you have here on either side, after the lateral incisor, you have a canine. The canine is that tooth that is, jagged and it is sharp. Canine. One is here and one on the other side. Whatever you have on the right, you also have on the left. Then you have 2 molars. First molar and second molar. Now it seems like this is a lot to know. However, it isn't really. When you take one, say the upper jaw or the lower jaw, let's take the upper one. You split it in half. And look at that quarter here, the right side. All you need to know, 1, 2, 3, 4, and 5. If you know that, then that is the same as the left side. And the same, if you know that as well, 1, 2, 3, 4, 5, you are going to know the other side, the lower jaw. And you go from central incisor and say, and then you go lateral incisor, canine, first molar, second molar. So if you know a quarter of the dental arches, 1/4, 1, 2, 3, 4, 5 teeth, then you know it all. And here are the dates, the times where these teeth erupt and when they fall out. So be familiar with them. Also be able to label these on a map. When I would show you this, for example, and say, name this and name that. Here is a more detailed one, and that is the adult or the permanent arch. We have the central incisors, lateral incisors. So these are the incisors, which are 4, 2 central, 2 lateral. Next to the central incisor, next to the lateral incisor on either side, you have the canine. One is here, one is here. And next to the posterior to the canine, you have now first premolar. It means the tooth that is the first tooth that is before the molar. So premolar, first premolar. And then you have the second premolar. So let's see, these are 2, 1 here and 1, 2 premolars. They also have different names. They also are called cuspids. So that is the first cuspid, and the second is the second cuspid. And you can see here here are the names here. Okay, the bicuspid, actually bicuspids. So it doesn't matter what name, as long as it is one of the names that are used. So I think it will be better if you say first premolar, second premolar, and then first molar, second molar, and third molar. Now your task is to go back to this arch and compare it with this arch and identify the teeth that are not here. What teeth does the adult arch have, or the permanent arch? What teeth does this one have that are not part of the deciduous arch? So identify them. You know, basically it's an easy job. You should be able to identify them. Then dental occlusion. It refers to how the upper teeth come in contact with the lower teeth, how the dental arches come in contact with each other. In normal, so we call this occlusion. Normal occlusion involves, you could see it, alignment of basically the contact between the upper teeth and lower teeth is in a way that the upper incisors cover part of the lower incisors. So here are the upper incisors, here are the lower incisors. So the upper incisors protrude forward and they cover part of the lower incisors. So that's the normal process here. If you don't do that, then you could have all different forms. For example, like this, where they are evenly like on top of each other. But you can see how different now the structure in the front is going to look. So again, normal alignment involves protrusion where the upper front teeth protrude, are farther forward than the lower incisors, and the upper front teeth cover part of the lower front teeth. Look in the mirror and see for yourself. If that is not the case, then the person will have malocclusion. So normal occlusion is called class 1 occlusion. That means normal occlusion. And then we have malocclusion, two forms, two kinds of malocclusion, and we're going to discuss them in just a minute. But let's see here, normal occlusion. How do you know exactly it is normal? Number one, the first molar of the mandible. So you look in the bottom, because the top is fixed. The bottom is movable when you lower the jaw and bring it up. So your start to identify, you go with the mandibular teeth, and you look for the molars. So the first molar here, first mandibular molar, is 1/2 tooth advanced going forward to the maxillary molar. Let's look. So here in this image here, you can go back. Let's label them. This is the central maxillary incisor, lateral maxillary incisor, canine, and first premolar, second premolar, and first molar. Now let's look here. You have central mandibular incisor, you have lateral mandibular incisor, and you have the canine, and then you have the first premolar, second premolar, and first molar. Now compare the first molar, the first mandibular molar, to the first maxillary molar. And you could see now exactly the mandibular molar is protruding about 1/2 tooth, past the first maxillary molar. So that's one very, very important condition that is going, to show you what normal. And you could see how these maxillary incisors are covering the lower maxillary incisors. So that's our first important condition to identify what normal occlusion is. The first molar of the mandibular arch, or the first mandibular molar, is 1/2 of a tooth advanced to the maxillary molar. So this way, the maxillary incisors, the second conditions, maxillary incisors project, they project by a few millimeters beyond the lower incisors. So that means if you have one of these tongue depressors, if you have it and you can kind of insert it, it might fit, it might not. If it is bigger than that, then there's a problem. So it's only a few millimeters in between. And then the other one is that the maxillary incisors cover the lower incisors with only a little part of the lower incisors showing. And again, all of this applies to these arches here. And this also is normal occlusion, or class 1. This is also class 1. See how bright the teeth are? It would be wonderful if our teeth stay like this all the time. But all right, so here also it shows us in this class 1 class 1 here, it shows us exactly the first molar advanced by about half a tooth to the first maxillary molar. Then class 2 and class 3 are malocclusion, which means it is kind of that that's not normal. So the class 2 malocclusion is called also destocclusion. In here, you have the first mandibular molar again, retracted, going back, retracted at least one tooth behind the maxillary molar. So let's go back. So here, the middle image, we have the first mandibular molar retracted by at least one tooth beyond the first maxillary molar. You say, yeah, but how come it is, it only half? No, you look where it is supposed to be. That tooth is supposed to be anterior, like advanced here. So it should have been actually here. It will be projecting beyond, anterior to the first maxillary molar. So it should have been here. So when you measure the distance between here and here, that is a full tooth. So the first mandibular molar is retracted at least one tooth behind the first maxillary molar. Now, what happened when we have class 3 malocclusion? Sometimes called mesoocclusion. So the first mandibular molar again is advanced, at least one tooth ahead of the first maxillary molar. Let's look again. So here it is, the first mandibular molar, and it is pushed way forward, one full tooth ahead of the first maxillary molar. So again, if you look here compared to here, that is supposed to be between, under both half of the first molar and half of the second molar. This is the natural place where it should, but now it is not under the first mandibular, the first maxillary molar. It isn't even under. So it's all the way from here to here. So again, if you think about it, I think you can find an easy way to remember them. The normal, or class 1, is just 1/2 tooth advanced, the mandibular. And then the second, which is this one, we call it overbite sometimes, or class 2 malocclusion, overbite. Sometimes it's called overjet. And you have one full tooth retraction. And then the other one, also the mandibular molar, first mandibular molar, is one full tooth advanced. So this way, this is basically the opposite of the second case. The third case, malocclusion, is also called, or the third class is also called underbite. And of course, all of these abnormalities are going to impact how the person looks, the facial structures. So you could see here, this person, what kind of occlusion does this person have? And now see, after the correction, that's completely now different. So it isn't just a matter of, misalignment. It changes the entire facial structure of the person. Now this person here has a smaller jaw, and you look how, after the surgery, how she has basically regained normal structures. And there are different techniques and different ways depending on the condition itself and so on. And you have, this person, for example, had a shorter side of the jaw, shorter on the left side than the right, and it depends on the cause, and that is fixed where she presents as having, basically two normal sides. Now, what happens in this case here? It isn't always clean cut, like class 1, class 2, class 3. This person most likely sucked his or her thumb, and that when the tissue as babies, all of these structures are soft and they change location all the time. So when the baby is sucking his or her thumb, they also even just, bring it in even to the, the end of the thumb here. So, and as they keep doing so frequently, that is going to push the dental arch forward, and it makes it unable to form normally. So it will be pushed forward and up. And as a result, you could see it here with the teeth that's supposed to be coming here, they are not. And also pushed forward. So that's the combination. This person here has what we know as an open bite, where also it involves sucking the thumb and pushing it up so much during childhood, and it is not corrected. And you know what they do when you go to the orthodontist, and there are different devices to bring down the palatal arch down. Okay, so now let's look at the structures of the oral cavity in terms of the outside or the soft tissue, the structures of the lips, and then we'll look at the facial muscles and yeah, that will put an end to this unit, labial and facial muscles. So the lips, we have this red piece where, when we put lipstick on, that area is called the vermilion border. Vermilion means worm-like. It looks like a worm. And because verma means worm. So that's the vermilion border, and it's on both lips. Then, if you trace this kind of borderline between the upper lip and the skin of the face, and on top of the upper lip, here, you can see it is just like a bow, just like a bow of an archer. And for this reason, somehow the Romans thought this was a mark of beauty, and it made people fall in love with each other. They called this Cupid's bow. Cupid's bow. The trough beneath the nose, that furrow between on top of the upper lip, we discussed it last time. It's the philtrum here, and the little ridges on the right and left side of the philtrum are called the philtral ridges. Philtral ridges. And we discussed also the nasal base here, and the little columella that is between the tissue between the two nares and the alar rims, or nasal ala, like this curvature of the side of the rim of the nostril and the apex of the nose. So let's now look at the muscle, the structures and the muscles of the lip itself, lips. First, we have the buccinator. You might encounter some people who might call it the buccinator, but it's more people say the buccinator. Before I discuss these muscles, you need to know for each muscle 3 things. For each muscle, you need to know the origin, you need to know the insertion, and you need to know the physiology, which is the function for each of these muscles. So the buccinator originates on the alveolar process of the maxilla, that area where the upper teeth insert. So, and also on the part of it originates on the mandible here. And the buccinator inserts onto the orbicularis, which the muscle that makes the lip. So sorry. So here I put 2 links for you to explore these structures further online, and in your textbook they're of course covered in detail. So the functions of the buccinator, basically this muscle left, right and left, it compresses the 2 sides of the cheeks. It compresses, it firms the cheeks while you are chewing food, for example, so that the food doesn't fall between your teeth and the cheeks. It doesn't fall in the buccal cavities, because if it does, it will cause a lot of problems, including dental decay and also smell and all kinds of problems, hygiene and different kinds of problems. And you don't want that to happen. Then we have the zygomaticus major and the zygomaticus minor. I somehow okay. Here you can see the buccinator muscle. It is inside. It is behind the risorius, and it is covered by other muscles. But it goes from here and it goes under the risorius and it goes down. So it firms the 2 cheeks as you are chewing and swallowing. And so then we have the zygomaticus major muscle, which is here. It goes from this cheekbone called the zygomatic bone and down to the corners of the lips. And then the zygomaticus minor muscle, sometimes minora and majora, zygomaticus minora and zygomaticus minora. So the zygomaticus minor muscle it lies next to and is smaller than the zygomaticus major, and the insertion point is towards on the front of the lip itself, but lateral, a little bit lateral. Then we have so the functions of these muscles is to draw the upper corner of the lips up and backwards, for smiling and for laughter and for facial expressions. So, smiling like this, you are going to lift up the corners here of the lips a little bit up and slightly. The orbicularis muscle is the muscle that makes the 2 lips. It's like a circular muscle, and it's supposed to act like a sphincter. It is, when it is at rest, it basically should close the mouth like a sphincter. So the natural position of the orbicularis is to be closed, to keep the mouth shut. It originates on the fibers of facial muscles that are surrounding the mouth, and it inserts onto muscles and skin of the angles. Oh, I have a typo here. Of the angles of the mouth. And the functions are to close and protrude the lips. The risorius is a muscle that inserts onto the corners of the lips here, and it has an angle, kind of. It's an angle like that. So this muscle originates on the tissue around the pterygoid salivary glands, which are this just around, this area here. There are salivary glands that, as you close your jaw and crush food, these glands release saliva. So as you could see, the origin here of this muscle on the tissue of the parotid, on the tissue of the parotid salivary gland. Then, and again, it inserts onto the corners of the lips, left and right, and the functions are to draw the corners of the lips backwards and slightly up for speech and for smiling. It's the muscle when you say cheese, you go ee, and you retract the lower parts, the corners of your lips, and you kind of bring them up a little bit. So it contributes to smiling and and also for speech when you say the sound E and I. The levator labii superioris, the word superioris means above. So you look at the muscles above the upper lip. And levator means to lift up. So basically the muscle that lifts up the upper lip. And also this muscle, levator labii superioris, there are two muscles that are close in origin and function. The labii superioris, levator labii superioris originates on the maxilla. So levator labii superioris originates on the maxilla. It's not exactly showing here, and this is not the best view, but and then it inserts onto the upper lip, and then the function is to raise the upper lip. The levator labii superioris alacnesi, it inserts onto, it inserts onto the rims and into the rims of the nostrils, or the alar rims, and the upper lip. And again, it contributes to raising up the upper lip, and it also dilates the nares. It makes, see, the openings of the nose bigger. You do that when you are running, or in certain cases, even sometimes when you communicate. And it contributes to sneering as an emotional expression. From the name, depressor angulioris, you understand depressor is to bring down or to lower. Anguli means angle. Oris means circular. So it has to do with the orbicularosaurus. So it depresses the corners of the mouth, and it helps compress the upper lip against the lower lip. So the muscle is depressor angulioris muscle right here at the corner, and it just to bring down, you can pull down the corners of the of the lips. The depressor labii inferioris. So here, depressor angulioris at the angle of the lips. And then you have the depressor labii inferioris that is beneath the lower lip. That the origin is the lateral anterior surface of the mandible. So in the front here, that's the front of the mandible here. So it originates on the anterior lateral kind of and lateral anterior surface of the mandible here, and it rises to insert onto the skin of the lower lip. And the function is to pull the corners of the lip downward for expressions like sadness and irony. The mentalis muscle is right in the center here, of the center of the lower lip, and it so it originates on the lateral anterior surfaces of the mandible and in the front here, right beneath the center of the lower lip, and it inserts onto the soft tissue of the chin. So this enables you to move the tissue here of the chin. So it raises the chin and protrudes the lower lip for expressions of doubt. If you go to the websites I shared over here, you are going to find many images and many descriptions and tables that describe these muscles. Now, out of this lecture, I would like you to be able to test yourself. I would like to ask you these questions. If you are not able to answer each question with 100% accuracy, then you need to listen again, and you need to read again, go back to your textbook, and you view this lecture again in order to make sure that you master the material. So here is the little study guide that is for this lecture. How does the hard palate form? What structures make up the hard palate? What age does the hard palate begin to form? And how does it fuse? Does it fuse from back to front or front to back? Trace the structures of the hard palate from front to back. What structures do the upper teeth insert onto? What happens, what medical condition results if the hard palate or the soft palate does not fuse? What condition do you get? You need to know the different names of the teeth when they start to erupt, when they fall. What are the names of each kind of tooth? Be able to identify these on a picture. You need to know the differences between the deciduous arch and the permanent tooth arch or dental arch. You need what kind of occlusions do we have? What is class 1? What do we call it? Basically normal occlusion. And what are the conditions for normal occlusion? What are the characteristics for the normal occlusion? You know, there are 3 or 4 conditions that you need to know one by one. What is the condition, or what are the characteristics of class 2 occlusion or distal occlusion? What are the conditions or the characteristics of class 3 occlusion? What is the vermilion border? What are the alar rims? What is Cupid's bow? What is the vermilion border? So what are the philtral ridges? Can you identify the nasal base? So make sure you are able to identify these on pictures as well. What is the columella? Where does it, where is it? Can you identify it? For all the muscles we discussed, look at each muscle, refer to your textbook and to the slides and to this presentation, websites, whatever, resources you have, and ask yourself, are you able to identify for each muscle the origin, the insertion, and the function, or the functions for each of these muscles? I do not want to name them here because in case I forget or leave one out, then you presume, oh, it is not going to be in the exam. So they are listed here on the slides. Go back to them, take them one by one, and you need to be able to identify the origin, the insertion, and the physiology or the functions. So that is basically, that is what I want you to know out of this lecture. And we, next time, we are going to speak about the lingual muscles, and then the rest of the unit, which includes the soft palate muscles and function. So thank you, and we'll see you next time.